City Housing Authority has been in peril many years before the pandemic struck. Monica Morales always reporting on this. But now residents are facing some new challenges and losing their lives to the virus.
The residents of NYCHA have been hit particularly hard, and we want to do a lot more to reach you, to help you, to bring you support, not just the testing, but other forms of support to help you through this crisis.
So that was yesterday, where a large portion of Mayor Bill de Blasio's coronavirus update really addressed concerns about NYCHA. This morning, we are talking live to NYCHA Chair and CEO Gregory Russ about the state of public housing. So good morning to you. Thank you for joining us. Both Mayor de Blasio now and Governor Cuomo have really discussed laying out plans to help NYCHA residents during this health crisis. They did it a few days apart. How often are you talking to both of them about the pandemic and really the effects that this is having now on public housing?
Well, our staff is obviously in conversations with both the governor's office in Albany and with the mayor, of course. So we're being very open and collaborative. We understand the importance of these initiatives. We think we're in the first phase, perhaps, of what will become a really bold and extensive testing program, both here in New York City and likely in the region. So we've been collaborating as closely as we can.
So you're talking about the first phase of testing, right? Testing sites being rolled out at locations near NYCHA facilities, as we've been hearing, NYCHA buildings as well. But the big question here is, this is not day one of this pandemic. We're a few weeks in right now. There have been a lot of complaints that testing was not made to NYCHA residents earlier on. So what was the delay in getting testing to so many of these communities where we're hearing there are racial disparities because of the numbers here?
Well, I think one of the issues that the way to think about this is testing is a national problem. We've had issues from the very beginning. We've had many claims about how many tests and where they're rolling out. And in that sense, New York City is not very different from some of the things we've encountered at the national level. So we're happy that we're actually able to start and to begin to provide the service in locations that will be accessible to NYCHA residents. But if you think about it, the testing pattern is evolved just like the advice and discussions about the virus have evolved. And I think we're now at a point where it'll be, I'm hoping for a good launch, and we can strengthen it over the next several weeks.
Yeah, I'm glad to see that there will be a lot of focus on testing specifically within the NYCHA community. But what's something you could have controlled earlier on was sanitizing of the building. So walk me through the sanitizing process for the workers, including PPE equipment for them. Monica Morales, our intrepid reporter, has been on the front lines. As you know, Mr. Russ, you know her very well, and you know how determined she is. And she heard from a number of residents who said they didn't see any cleaning. So how often is cleaning being done?
So we have two vendors doing cleaning, and it's 5 times a week in the senior buildings, and it's 3 times a week in the family sites. And these are quite large efforts. And I want to say that one of the things that we have to remember is we're cleaning high touch points, the surface points where somebody would put their hand or push an elevator button or hold on to a mailbox or open a trash chute. So those are the things that are being cleaned. We are monitoring the cleaning vendors. We have information lines available if residents want to call in something or uncertain. But we also have a large team of compliance and quality assurance and environmental health and safety folks who spend a good part of their day checking on vendor reliability and checking on the job that they're doing. So that is happening and
when you say 5 times,
several weeks now.
When you say 5 times a week, I just want to make sure, is it every single building within the NYCHA community?
Oh, no, I'm sorry. Those are the senior buildings are 5 times a week, and the families are 3. So
Okay,
if you have
got
a
it.
senior
So
property,
I also want to talk about resources.
Yeah, please go ahead.
Yep. I also want to talk about resources being made available for residents who just simply cannot pay their rent, right? We know that that has been such a struggle as so many people
Sure.
lose their jobs during the pandemic. So what is NYCHA doing about that? And for those folks who just simply cannot pay their rent right now, what kind of resources are you making available for them?
So we have, if we think about how the NYCHA population profiles, we have about 76,000 families who have employment income and are most at risk. Other families have fixed incomes either from things like Social Security or disability. And those families, if they experience a loss of income, we have a rent hardship policy. The hardship policy will allow them to contact us, and we can begin the process of reducing their rent to whatever income that they happen to have, whether that's unemployment or some other source. That rent will be adjusted down. And because of the processing, rent tends to be a monthly cycle. If they call in and we can't get that adjustment in the first month, we will make it retroactive. And no one need fear the loss of housing if they get a rent bill that doesn't immediately reflect the adjustment. We're not doing any administrative actions or taking any steps along those lines, and we will adjust the rent to the income that they have.
Good to know. And Mr. Russ, I'm being told we have to wrap here. We're running out of time, but this is our first time we've ever had you on the morning show. So I do want to ask you one more question here, and it's
Sure.
about your employees as well. They are on the front lines right now. They are the ones who are sanitizing these buildings and working, trying to replenish and refill those work orders that still have to be filled, right? Broken pipes and things like that. How are they
Correct.
doing on the front lines, and do they have enough protective equipment?
So, first of all, I want to commend them. We do not operate without that staff. They have been coming to work regularly under difficult conditions. In the beginning, we struggled to get protective gear just like everyone else. But in the past few weeks, we've taken shipments of gloves and masks, the kinds of masks that are for daily use, not the healthcare masks. But we are now supplied and have distributed those to all the properties. So we have enough for several weeks. We're ordering more, of course, but they should be able to mask up and wear their masks. And we actually will be checking on that as well. We have a team that checks on social distancing and on the use of the protective gear. So we're hoping that they're going to be well stocked.
And they're also still filling in those work orders that need to get filled that Monica's always reporting on?
Yeah, there's emergency work orders are being done. We have selected several critical ones, like if, for example, if you lose your stove or refrigerator, we're still going to respond. If there's a leak, we're going to respond to that. Obviously, heat, hot water, elevators, essential services are the focus.
Understood. Mr. Russ, I do appreciate your time this morning. This was our first chat on the morning news. Don't be a stranger. You're welcome back anytime because
Sure, no,
NYCHA is a huge part of our city and our community.
Yeah. No, I'd be glad to. And give my regards to Monica, please. Thank you.
I will. I know you guys are very tight. All right. Thank you again. Yeah.